Okay. Hi, everyone. It's Doug Overbold. I'm a Senior Vice President with CTFO. We're changing the future outcome with some of the greatest CBDs available on the market today. I'd like to introduce a friend of mine, Dr. Stephen Trobiani. Steve's been a practicing neurologist for, the past 35 years. He's board certified and runs a very successful practice here in Minnesota. So, Stephen, thanks for joining the call. Could you tell us a little bit about your medical background and what got you interested with these CBD oils and this whole endocannabinoid system?
Sure. I have, since I finished my neurology training at Yale and went into practice, I have been focused on the evaluation and management of conditions that primarily produce pain. So I deal with injuries to head, neck, back, and deal with a lot of headache, deal with a lot of neck pain, deal with a lot of back pain. A good number of the people I treat have conditions that are primarily arthritic in nature. They are not going to be resolved surgically. They're not going to be resolved with any interventional procedures, so they have to be medically managed long term. A lot of these folks are on opiates. As you know, we are trying hard to minimize the amount of opiate we use, and so adding something that would address pain would allow me to maybe taper the opiates a bit. CBD has become a popular product as a pain reliever, and justifiably so, because it does have pain relieving properties. It does have anti-inflammatory properties. And so this was something that I have been thinking about for a while, and something that I wanted to begin offering to my patient population. The question was, which products from which companies, because there's a wide range out there.
Yeah, well, thank you. And we see the CBDs helping people certainly for pain, but also it's so interesting to see people that have anxiety, people with seizures, autism, high blood pressure, diabetes, and it's so amazing to think that there's this natural ingredient that comes from the cannabis family that is treating such a wide variety and helping people on such a wide scale. So, Steve, when you looked at CTFO with our 70 different products and, of course, our 10X Pure, our patented flagship, what was your thoughts with CTFO, and why did you make this your go-to CBD company?
Several reasons. One is certainly I want products that are derived from hemp, not from the marijuana family, because I want something that's not psychoactive. There are enough problems with patients who are on opiates already that I didn't want to begin throwing cannabis at them as well. So hemp doesn't have much THC, and what THC is there can be extracted, and there are some isolates within CTFO's product line that do that. So their approach, which was to take products from hemp and not from the cannabis group, was attractive. The other is that their products are ISO tested. So there are outside labs that validate what's in the bottle and the purity of what's in the bottle, and that's important. And then the pricing has to be at a point where the product line is actually affordable for people. And in looking at that, I took a look at especially 10X Pure and compared that to the market for Celebrex, because that's an anti-inflammatory that I have been involved with for quite some time. I actually worked as a spokesperson doing meetings for physicians when Pfizer first came out with that product 20 years ago. And Celebrex pricing is about the same as the 10X Pure pricing, and they actually accomplish the same thing. Except 10X Pure can't raise your blood pressure; it will lower it, whereas Celebrex may raise your blood pressure.
Yeah.
It's actually a better product.
Well, we're really thrilled to have you on our team and being a spokesperson with your background and your credibility. Last question today, Steve. we've got this free CBD business that goes along with the opportunity to improve your health, and you can also improve your health. And I know that you've been an entrepreneur along with being a doctor for so many years. So just what was your thought when you saw this business model being able to build a residual income while you're able to help people with their health?
This is an enormous market, and we are at the early stage of an enormous market. CBD has the interest in CBD has really spread widely. So the competitors to CTFO have already laid the groundwork. They've already established the interest. Now it's time for a company that has all of the characteristics that I just talked about to come along and capitalize on that interest. And that's exactly where this company is standing. So from a business standpoint, this is an incredibly good opportunity. If you consider the number of people who are taking Advil, the number of people who are taking Aleve, this is a product which is better in many ways than Advil or Aleve, simply because of the fact that, especially, again, your flagship product is a selective inhibitor of prostaglandin synthesis. So it does so in a way that it produces an inhibition of inflammation and reduces pain, but doesn't raise your blood pressure, doesn't erode your stomach, which Advil and Aleve certainly would do. So if you displace that market, consider what that would be worth.
Billions and billions, and it's really an advantage to have worldwide exclusive rights to 10x Pure, our delivery system, which we'll be expanding upon into other product lines as we grow this. So, Steve, thank you so much. This will be just our segment one. I'd like to come back another day, and we'll maybe focus a little bit more on the product line, and a couple other segments we might focus a little bit on the business side of it. So that's it for today, folks. Thanks for listening in. And we'll